Hello, I'm Curtis Baxstrom, member of the AOA Vision Rehabilitation Committee, and what I'm here to share with you today is a few insights in regards to concussion, and we're specifically in regards to the issues of dizziness. So what I like to start out with is, first of all, there is a difference between dizziness and vertigo. Typically, vertigo is usually more considered a condition of benign proximal positional vertigo, which is where the crystals will be off and you'll have some nystagmus secondary to that. But most of the conditions of dizziness is really more related to disequilibrium or being off balance. So there is some confusion regarding dizziness and vertigo because sometimes they actually are overlapped in the literature as well. So what we're going to be talking about today is disequilibrium and also that sense of dizziness from what's going on. So let's take a look. How would us as an optometrist evaluate dizziness? Probably one of the most easiest ways is to go ahead and take a look at what's called the dynamic visual acuity test, and that's what I'm going to describe to you today. Basically what you do is you go ahead and have your routine exam done, you take your visual acuities, but after the visual acuities are given, you have the patient look at the chart and then rotate their head 2 cycles per second, and during that time, check to see what their visual acuity is. So typically the patient's looking at far and they're seeing 20/20. You ask them to rotate their head 2 cycles, 1001, 1002, 1003, about that speed. And you ask them what line of acuity can they read during the test. Often these patients will stop their head and then read it, but that's not the test. The test is done during head movement. And because the visual and vestibular systems have an intricate relationship regarding the VOR gain, if you take a look at the visual input and the vestibular input, when you turn your head and rotate, those two systems should be synchronized. It goes through several different brainstem mechanisms in the cerebellum to go ahead and maintain stable vision. But what happens in the case of a concussion is the patient rotates their head and those two systems are no longer working efficiently together. So what do we do with these kinds of patients? Well, there are some very interesting aspects, and if you have a patient who has a progressive lens, that means that you're going to have different powers in different areas of the lens, and that will often throw the VOR gain off because the patient's not able to adapt to it. Commonly as optometrists, we will remove them as the progressive lens and go to 2 pairs of glasses, one distance and one near, or possibly looking at maybe contacts and glasses for near. So those are some of the options that we have. But we got to really be careful because many of these patients do not do well with a progressive or also a monofocal type of situation where you have one contact lens for far, one for near. So we want to keep those types of things in mind. Now, the other thing is you can check your refraction too, because a little bit of plus will give you a slight magnification. The VOR gain actually increases with VOR gain. So what happens is you might go ahead and check the visual acuity, look at distance, and the patient rotates their head, gets blur, put plus 25 or plus 50 over the RX and repeat the test, and very commonly it will stabilize the image because the magnification improves the VOR gain. So us as optometrists are very critical in the rehabilitation process because we can provide that lens evaluation and help that patient get better. Lastly, there's also some other tools that we have too. We may use, besides lenses, we can use base-in prism, binocular prism if with a binocular issue. We may use binasal occlusion. We may use also tints and filters. And lastly, vision therapy and or vision rehabilitation. So those kind of give you a big picture of the area of dizziness. Again, working with your patient regarding the dynamic visual acuity test is a very simple test that you can add into your regular exam, and it just takes a minute or so. So I hope this information has been helpful for you, and I hope you have a great afternoon. Have a good day.